Good evening, everyone, and welcome. Today we're joined by Dr. Maz Ganat, Chief of Urology and Program Director of Urologic Oncology at Englewood Hospital. Dr. Ganat will lead a candid discussion today on prostate cancer and men's health and explaining the importance of early detection. If you have any questions during this presentation, please feel free to comment them below in the Q&A box. We will answer all your questions at the end of the talk. We also have an option for transcriptions and translations. So if you would like anything to be written in Spanish or any language, please follow the instructions that I just sent in the comment section as well. As you may all know, the Live Well Center hosts these monthly health talks to share important information from leading experts and clinicians. So to also learn more about upcoming talks, please visit our website that I'll also paste in the comment section. And at the end, we'd greatly appreciate your feedback through a short survey, and it helps our center improve any future sessions. So please join me in welcoming Dr. Maz Ganat.
Thank you, Angela, for the introduction and invitation to give this talk. September is Prostate Cancer Awareness Month, and we'll definitely cover that in the talk as well, and kind of give a broad talk on kind of men's health and some introduction. So the talk today, as I mentioned, will be Introduction to Men's Health. As Angela mentioned, I'm Maz Ganat, the Chief of Urology at Englewood Health, and as well as the Director of Urologic Oncology. The goals for the talk is to discuss health risks that are facing men, learn about lifestyle choices to improve health, and learn about health screenings and when to see a doctor. We'll also briefly discuss common urological conditions, urinary or prostate issues, erectile dysfunction, sexual health, and we'll make sure to leave some time at the end of the talk to address any questions that you may have. So when we talk about men's health, I like to separate in different categories. We talk about lifestyle changes, we talk about nutrition and weight loss, exercise, mental health and stress management, routine checkups. So I mentioned prostate cancer screening is very important, which we'll get to later in the talk, and safety measures in everyday life, at home and at work. So if we look at causes of death in the United States, heart disease is number one, and cancer is number two. This is as of a few years ago. And unintentional injuries is number three. This was taken kind of after COVID, so that's included in there. And followed by stroke and other types of diseases. And if we look at heart disease, people dying of heart disease versus dying of cancer, you'll see over the past few decades, deaths from cancer has been rising. And we'll kind of go into potential reasons for why. Now, the good news is that this is kind of a busy graph, but it's showing 5-year survival of all types of cancers in the US. Now, this is kind of old data, but this was reported, from comparing 1970s to 2000 up to 2013, and we'll see, although cancer is rising, the cure and survival rates in the United States are significantly improved in all types of cancers. And number one is, it appears, prostate cancer, which is significantly improved survival, compared from the 70s to now. Other types of cancers like liver and pancreas, unfortunately, still is a little bit better, but the survivals are not great. So one reason for rise in cancer is aging population. So this is as of 2010. The life expectancy went from being somewhere from in the 40s and 50s. Now it's up to 70s, even close to 80s. And if we look at, some numbers from 2021 and 2022, we see life expectancy of men is about 73 to 74. And in women, it tends to be 79 to 80. And if you make it to age 65, your life expectancy may be even higher. So the longer people are living, the higher chance of getting cancer. So what can I do to improve my health? This is, I think, a very important topic. So this is a chart that, talks about relative risks, contribution to cancer. And we see here, number one risk factor is smoking. So smoking cessation is very important, followed by obesity, being overweight. And so these two are the top most common ones, followed by other, less common causes. Now, smoking can affect all the organs in the body. And this is kind of showing what, organs smoking can affect. And if there's one thing that, we take away from this talk is that, smoking and weight loss is very important for your health. Smoking cessation, I'm sorry, quitting smoking if you do smoke. So the next thing is obesity and risk of cancer. Being overweight or obese increases risk for 12 types of cancers. Prostate cancer is not listed here, but kidney cancer, something that we deal with in urology is, and that's important to know. And 7 out of 10 Americans now are either overweight or have obesity. And only about half of all Americans are aware that obesity is linked to cancer. Now we look at BMI, body mass index, and normal BMI should be about 18.5 to 25. So anything over 30 is considered obese and much more concerning. So weight loss is very important. So, in terms of risk factors, stroke, heart disease, these are commonly linked to obesity. I would add in the urology and the men's health world, low testosterone and erectile function are also linked to obesity. So weight loss is very important. Now, a lot of my patients ask, what's the best diet? What do you recommend? So this looked at different, diet, like a healthy diet, which is high vegetable, fruits, fish, whole grains versus a Western or carbohydrate diet. A Western diet is considered processed meats, a lot of red meat, and high sugars. And we found that Western and carbohydrate diet are higher risk for prostate cancer. So usually I recommend what's called the Mediterranean diet or a diet high in vegetables, fruits, fish, and whole grains to patients. We talk about inflammation. Inflammation is necessary for normal immune response and wound healing. However, chronic inflammation can lead to diabetes, cancer, heart issues, and other types of chronic illnesses. So in terms of diet, we talk about an anti-inflammatory diet. We talked about fruits and vegetables, high fiber, whole grains. Pro-inflammatory, which is not healthy, is saturated fatty acids, trans fatty acids, cholesterol. These are red meats and processed foods. Another theory is that obesity causes insulin resistance, and increase in something called insulin-like growth factors, and that's a risk for cancer growth. And we talked about inflammation. So we talked about smoking and obesity. These are very important risk factors. Now, what's good for overall health is exercise, regular exercising. So it helps with weight loss or weight control. You can combat health conditions like heart disease, cholesterol, high blood pressure, stroke, depression, cancer. Improves mood, self-esteem, and confidence. Boosts energy, boosts testosterone levels, improves sleep, enhances sexual activity, and it's very important to exercise regularly. And the goal is about 150 minutes per week of moderate intensity, exercising or physical activity. This is an interesting article that I found. The age doesn't matter in terms of exercising. You could be active, young, old. It's important to stay active. Now we talked about chronic stress. This is just a list of bad things that chronic stress can cause. And it's important to have ways to kind of be able to relax and de-stress. What can patients do? What's recommended? Some people do meditation or yoga. We talked about exercise, spending time in nature, music therapy. We're fortunate to have the Graft Center for Integrative Medicine, which offers a lot of different types of strategies for stress reduction in the hospital. And some patients like gardening. I think that's very powerful as well. So routine checkups and common urologic conditions. What do we treat as urologists? The first thing and most common is the prostate. So we'll start with the anatomy. What is the prostate? Where is it? So the prostate is an organ that sits right under the bladder, around the urethra. That's where the urine comes out, and right on top of the rectum. And it's about a walnut-shaped organ, and it produces fluid that mixes with the sperm, and that's kind of why it's sitting in that location. So here's the prostate gland here, as I mentioned. This is the bladder, and this is another view of the bladder here, and this is the urethra where the urine passes. So we can see if the prostate is enlarged, which is usually a benign condition, it can block urinary flow, and the rectum sits right behind it. So patients that have constipation or kind of GI, gastrointestinal issues, that can also affect urination. So common conditions in men over 50, erectile dysfunction, urinary symptoms. We talked about BPH, or benign enlargement of the prostate. Urinary tract infections can be seen in men, is not as common in women, but can be seen. Same thing with leakage of urine, urinary incontinence. And prostate cancer, which I'll get into shortly. In terms of medical conditions, we talk about heart disease being the most common medical condition, and that we see in men over 50. And other chronic illnesses such as high blood pressure, diabetes, cholesterol. These are very common. Now, this is some cancer statistics from 2023. Estimated new cancers. So prostate cancer, and these are, I'll show you the new numbers from 2025, but I just want you guys to focus on the top here, the most common type of cancers in the United States. And in men on this side, prostate cancer is the most common type. This is not including skin cancer. And lung is number 2. Colon cancer is number 3. And then we also treating urology, bladder cancer, and kidney cancers, which are not as common, but still top 10 most common type of cancer in U.S. men. On women's side, obviously women do not have prostates, but most common type of cancer in women is breast cancer. Now, if we look at survival, although prostate cancer is very common, the survival rate it tends to be pretty good. So it's actually second most common cause of death in the United States. Lung cancer tends to be the most lethal. So take-home message for the first part of the talk, before I get into kind of prostate cancer and prostate cancer screening, is lifestyle changes is very important. We talked about smoking, obesity, regular checkups with your primary care doctor to make sure blood pressure and diabetes and everything is under control. Undergoing routine screenings for cancer and other things. And it's important and that you guys are here, and I appreciate you taking time out of your busy schedules to listen to my talk. And knowing is the beginning, and we must kind of apply our knowledge. So we talk about prostate cancer. Recently prostate cancer has been more and more in the news, and patients are now well informed, and a lot of my patients kind of ask about screening and who should get screened and who should not, and why detecting prostate cancer is important. So this second half of the talk will focus on prostate cancer. And as I mentioned, we want to highlight this, especially in the month of September for Prostate Cancer Awareness Month. So here's the latest data, estimated cases in 2025, this year. Over 300,000 estimated new patients. So these are patients getting diagnosed with prostate cancer. And that's about 15% of all cancers in the United States. And over 35,000 patients are estimated to die of prostate cancer in this year. And these numbers continue to rise over the past decade. The good news is, and especially for prostate cancer that's caught early, the survival rate is very high. Even in more advanced cases with treatments, patients do live a long time. Now, in terms of we talk about lifetime risk of developing cancer. So approximately about 13% of men will be diagnosed with prostate cancer at some point in their lifetime. And there are an estimated more than 3.5 million men living with prostate cancer in the United States. So these are, this is a very common disease. Now, these graphs are looking at 5-year survival if prostate cancer is caught early, that's called localized or regional, versus late with the cancer spreading. So we see 5-year survival rates are almost 100% when prostate cancer is detected early in early stages. But once it's spread, the survival drops to about 38%. So that highlights importance of early screening and early detection. So this graph looks at prostate cancer. This is from 2018 in terms of how common it is and the risk of dying from prostate cancer. So in this first graph over here, we see that in 1990s, the PSA, that's the blood test for prostate cancer, was approved. So initially, there was a spike in how much we were diagnosing prostate cancer, and kind of leveled off from there. And if we look at survival rates from prostate cancer from 1990, we see that since picking up prostate cancer from screening, the risk of dying from prostate cancer really came down. So mortality or dying from prostate cancer fell about 52% from 1992 to 2015, and this was because of routine screening. Now, I mentioned the PSA. What is the PSA? Well, it's a simple blood test, and it detects what's called an antigen that's produced by the prostate. It's called prostate-specific antigen because only prostate makes this, but it's not specific to prostate cancer, meaning inflammation and large prostate, prostatitis, or sometimes even bike riding or vigorous exercise. That can all make the PSA go up, but it's an important screening tool that we have available, and it is also dependent on age, but normally in men of screening age that we talk about, kind of normal range should be about 3 to 4. But as men age, this can it's normal for the PSA to go up with aging as well. So prostate cancer screening, it's a blood test. It could be an exam. That's the what's called a digital rectal exam. That could be done in the office. And the combination of those two, usually done by the primary care, will determine the need to see a specialist, see a urologist. And once, if we suspect prostate cancer or we worry about the PSA, being high, then we talk about doing a prostate biopsy or an MRI of the prostate. Now, I want to highlight the risk factors. So African American men have the highest incidence of prostate cancer, and they're about 60% more likely to develop prostate cancer compared to Caucasian men, and more than twice as likely to die from it. So they're at higher risk of getting prostate cancer and having more aggressive prostate cancer. We talk about genetics. So family history is a known risk factor for prostate cancer. And for men with multiple family members with prostate cancer, we do offer genetic testing or counseling. There are other risk factors, such as our veterans who were exposed to something called Agent Orange. That's a known risk factor for prostate cancer. And there may be some reports that firefighters or people that were exposed in 9/11 may be at higher risk for prostate cancer as well. So before we talked about the anatomy, the prostate sits over here. This is typically how we do an exam to feel for any lumps or bumps. And this is typically how a biopsy is done. There's an ultrasound in the rectum. We look at the prostate, and we take some samples of the prostate. Now, we have the technology now. I think in my practice, almost all patients are getting an MRI before the biopsy, which, if you look at over here, this is the prostate. And if there's what's called the target lesion, we can do a more accurate biopsy if something shows up on the MRI. Now, if the MRI is normal, it's a great start. It's not perfect, but we have other tests. We look at the size of the prostate, and we have other tests available to see if we can avoid any unnecessary biopsies. I think one concern, or one of the biggest concerns that patients bring up to me, is a risk of infection. So a traditional, what's called a transrectal biopsy, the risk of infection could be anywhere from 1 to 5%. And that's because the ultrasound is in the rectum and the needle is also going through the rectum. So one or two men up to 5 out of 100 men may come back with fevers, which could be very dangerous. Now, there's a newer way of doing a biopsy. It's called a transperineal biopsy, which I'm a big advocate of, and which I started the program here at Englewood Health. That's where the ultrasound is in the rectum, like in this picture, but the needle goes through the skin right above the, between the scrotum and the anus. And that brings down the rate of infection to about 1 in 500. So it's much lower and much rare risk for infection, and it may give us a more accurate biopsy as well. Now, importance of prostate cancer education and shared decision making. I think this talk kind of highlights the importance of prostate cancer awareness and education. I want to highlight that most men will not have any symptoms from prostate cancer. So in early disease, men will not feel anything. If men have urinary symptoms, that's usually from a benign enlargement of the prostate. Now, if prostate cancer progresses or is kind of more advanced, those patients can show up with blood in the urine or what's called urinary retention, inability to pee, and other types of complications. Now, there was one concern with the PSA. I mentioned it's not very specific or accurate for prostate cancer. So this led to unnecessary biopsies or what's called overdetection. And in the past, I think everybody was getting PSA tests. So we don't recommend it in men over age 75 or with life expectancy less than 5 years. And we don't, and usually would recommend it for men over the age of 50, unless there's family history or African American race. You can start screening even at age 40 or 45. So one other concern is, once diagnosed, there's no single best treatment, but I would add, and treatments can have sexual and urinary side effects. But I might add that, over the past 10 to 20 years, we've continued to improve on treatment options for prostate cancer to minimize side effects. And for low-risk prostate cancer, we've established what's called active surveillance, where we would monitor patients. So I think it's reassuring for patients, and if prostate cancer is caught early, we're able to maximize recovery and cure, but also minimizing sexual and urinary side effects, whether that's robotic surgery or neuroradiation treatments, or kind of newer techniques called focal therapy, where we would treat the area of the cancer and save the rest of the prostate. So take-home messages for prostate cancer. Talk about right treatment for the right cancer in the right patient at the right time. It starts with screening. So it's very important to speak with your primary care doctor to see if prostate cancer screening is right for you. I would highlight patients' African American race or family history or any exposures to any chemicals that I kind of mentioned are at highest risk, and should undergo screening at age 40 or 45. Patients at average risk, I would usually recommend at age 50 to 55, up to the age of 75, if healthy. Now, we talked about an MRI and role of biopsy. We talked about safer techniques to do a biopsy with less risk of infection. And if prostate cancer is detected, patients that have low risk cancer or sometimes even medium risk, we're able to watch these patients safely. That's called active surveillance. Patients with more aggressive cancer, we're able to offer them treatment options such as surgery, robotic surgery, or focal therapy, which is what I do, or radiation therapy done by a radiation doctor. Now, I will add and highlight once prostate cancer spreads or metastasizes, that's the medical term, there is really no cure. Patients still live a long time, but these patients are managed by a medical oncologist, and we have a lot of newer treatment options. But unfortunately, in those cases, the, there is really no cure once it is spread. So I'm going to stop my talk here. We would like to take the next 10-15 minutes to answer any of questions that you may have.
Thank you, Dr. Ganat. We have a couple questions in the chat, so I'll go ahead and start reading them to you. A participant has asked, for men who are resistant to testing because of reasons connected to quote unquote manliness, ego, etc., how do you talk to someone and help them be more receptive to getting tested?
Well, I think, in terms of the initial testing, this could be done with the annual blood work that's done with the primary care. And I would especially, emphasize, men that are at risk for prostate cancer, at higher risk. I think it's very important to at least, obtain a blood test from the PSA. And most prostate cancers do present with a high PSA. There are some prostate cancers that have normal PSA, and the exam is very important. But some men, it's not a comfortable exam, and they don't want the rectal exam. But I would definitely emphasize the importance of the blood test.
Okay, great. Someone also is asking for further explanation on the side effects of treatment options for prostate cancer, I'm assuming.
Yeah, so I think that kind of ties in the first question as well, is, if let's say a patient is diagnosed with prostate cancer, the biggest worry is, okay, I need treatments, and those treatments can have side effects. So it can affect sexual function, like erections, urinary function, like men are worried about leakage of urine. So I would add to that, in the past 20 years, a lot of patients that are diagnosed with what's called low-risk prostate cancer are monitored. They're put on active surveillance, which has none of these side effects, and we would monitor them every 6 months. And we have patients that are, 10, 15 years on active surveillance and have done well. Patients with a little bit higher risk cancers, I highlighted, with robotic surgery, we're able to do what's called a nerve sparing procedure, where we try to spare all the nerves that cause men to have erections. And there is a recovery period, but for men who have good erections before surgery, if we're able to do what's called a full nerve sparing, they should be able to have good erections after the surgery, with or without help of some medications. Now, it may take some time for the healing to take effect, but that's kind of, those outcomes have really improved. In terms of leakage of urine as well, men who are active and do not have obesity, they tend to do much better, and younger tend to do much better with surgery. And the radiation side, there has been huge improvements in giving radiation therapy for prostate cancer safely, and minimizing the side effects of sexual dysfunction and urinary function. And that's come a long way. And the latest technology that we have available is called focal therapy, where men who have their cancer is in one kind of tumor or one spot on the MRI, we can treat that area with what's called focal therapy, and minimize these side effects, such as loss of erections and leakage of urine. So that's kind of been established in the past 4 or 5 years as well. So our goal is to continue to improve our outcomes, treat patients well, and minimize these side effects.
Okay. And a follow-up to that question, are men told to freeze their sperm who are partaking in treatment?
So patients with prostate cancer that are, one of the other side effects is infertility. The prostate, as I mentioned, produces fluid that mixes in with the sperm. That creates what's called the semen. That's what comes out. So most men after treatment, especially with either surgery or radiation therapy, do experience loss of any fluid. No fluid comes out like when patients ejaculate. So patients that are still interested in having children, they are encouraged to do sperm banking before any treatment.
Okay. I actually have a question for you, Dr. Ganat. So you mentioned that you brought a type of biopsy to Englewood Health that lowers the risk of infection and is overall more accurate. So why is this not a more standardized test that's used in all institutions, or is it?
So there's more and more data coming out in regards to transperineal biopsy as a um, safer method. Um, and some of it is just technical ability, some of it is education. Um, both types of biopsies can be done well, but I would add the transperineal biopsy, if there are resources available and technical abilities, does offer improved infection rate, and you know and in some cases may give a more accurate biopsy as well. So, we still offer both types of biopsies. The traditional biopsy can be a little bit quicker, or, done a little bit better tolerated in some cases. But I think it's important to have the ability to be able to do both and offer patients both techniques.
Okay. We have one more question. So as a wife, any advice for how to talk to your husband about screening?
So in terms of uh, giving advice, I would just highlight that prostate cancer is very common, and in fact, most of my patients that are diagnosed with prostate cancer, a lot of them tell me, "Oh yes, my friend was diagnosed," or "My family member had this treatment." Everyone kind of knows someone that has it, and um, I would highlight that the importance of screening, meaning that if there is prostate cancer, it's better to know about it, um, and to see a specialist that can, um, if treatment is needed, to treat this before it kind of spreads or becomes much kind of bigger issue. So uh, that was my goal of this kind of talk in terms of education and encouraging patients to continue to, speak with their primary care physicians in terms for prostate cancer screening.
Okay. Well, thank you so much for a really informative talk, Dr. Ganat. We appreciate you spending time with us here today. Everyone else on this call, please, we have a survey. We would love for you to take it. It really informs our future sessions and seeing and understanding our audiences. There's one in Spanish and in English, so please click the links and take our survey. Thank you so much, Dr. Ganat.
Thank you, and thank you for everyone joining in. Hopefully that was informative. And thanks again to the Live Well Center for including this important talk.
Thank you again. Everyone, I'll stay on for 30 seconds so you can click the survey.
Okay, bye-bye.
Bye. Thank you, Dr. Ganat.